Okay, and medication compliance. So we want to avoid multiple emergency room return visits, right? We want to keep these patients well educated, have the resources available out there. It's not always reality, but we do the best we can. And some people just don't want to take their medications. Or what I find is, and what is true, there's a lot of issues with money. Insurance doesn't cover it. People fall into the donut hole for Medicare, and Medicare doesn't cover their medications during a certain time during the year because they've done their maximum out of pocket. So they'll take it every other day or every third day. So it's very common that people don't take their medications as prescribed. And very commonly when people come in my office, and this is no different than an ER setting or hospital setting, if their blood pressure's high, you can't just assume it's high and they're on medication. Even if you see, let's say they're on lisinopril or hydrochlorothiazide, and they come in and their blood pressure's high, I can't just assume that they're taking that medication as prescribed. I need to ask them, have you been taking your medications daily as it's prescribed? Have you missed any doses? Because the last thing you want to do is make a change in their medications and have them go home and start taking it every day, and then their blood pressure really drops too low. So there's multiple reasons. Okay, I'm going to switch over to coronary artery disease. Another term could be they can have an MI. If you have an MI, you have coronary artery disease. So the heart arteries have some plaque buildup, have a blockage. And so I want to focus on particularly walking through a patient that comes in with chest pain. And I drew a heart here and then I drew an artery here. So usually, most of the time what happens is you have a little bit of plaque buildup and a little piece becomes unstable and it ends up breaking away from the vessel. And what happens then? You have platelets, you have fibrinogen and fibrin. Many things are coming to here to prevent it. It says, okay, we have an owie now inside. So they try to protect the area, build up platelets, and then block off the artery, therefore causing a complete blockage. So wherever the blockage is, it'll block off after that. So this is why people that have a left main disease, or that's the left main artery, if that becomes blocked off, pretty much their entire heart muscle is not getting blood or oxygen. And that is called the widowmaker and very dangerous. But regardless, any artery that becomes blocked needs to have an intervention. And if you come in with chest pain, or some people stay at home and have chest pain for a few days, the main thing is, are you having pain that is persisting? Is it even at rest? Are you having chest pain? Is it with activity and at rest? How long is it lasting? So you're going through your old carts. Some people have different types of symptoms: jaw pain, arm pain, radiating down the arm, shoulder blade pain, nausea. I've had women have nausea only and they thought it was her gallbladder. Turns out she's having an MI. So the characteristics can vary, because remember, we have nerve endings all over our body, but we have nerve endings in our chest that just can get referred. So for example, if someone has reflux or heartburn issues, sometimes they can feel it in their back or on the right side of their chest. This is no different than cardiac or heart chest pain, and we need to take it serious. So let's say this male arrives to the emergency department with chest pain. What are some specific labs other than your normal labs you're going to get, like a CBC, CMP? You're going to get cardiac enzymes, right? You're going to get CKMB, which is specific to the cardiac muscle, CPK, which is another muscle enzyme, and troponin. So remember, troponin is specifically in the heart muscle, and you're not supposed to have a lot of it in the blood. When the heart starts not having oxygen going to it, that troponin then gets released into the bloodstream. So if your troponin's elevated, you have to think they have something cardiac going on. Of course, you have them on the EKG machine, and you're seeing if there's any changes to the EKG. As far as diagnostic testing, what are you going to take them for? You're going to take them, now if someone has an MI, you're not going to take them for an echocardiogram. You're going to take them right to the cath lab. And they're going to have a cardiac catheterization where they go in through the groin or the brachial artery. It used to traditionally always be in the femoral artery in the groin. Now a lot will do the radial and brachial. But it's still done all three ways. So you take them, they go in with a catheter, and they find out where the blockage is. They put dye through, where's the blockage, and they deploy a stent. Most stents that are put in now are called drug-eluting stents, so they're coated with a drug that helps prevent failure of the stent. So post-cardiac catheterization, so this patient has a catheterization, he comes back to your floor, now you're working on a cardiac step-down unit, and what is your main thing that you're going to be looking at? You're going to be looking at the EKG. I know this EKG does not have a good QRS, but just pretend it does and it's normal. So you're going to watch their heart rhythm. You're going to listen to their heart tone. So assessment's really important. You're going to, if they had it in their femoral artery here, there's a complication called retroperitoneal bleed. Because remember, it's in an artery, and yes, we can stop the bleeding to the artery, but sometimes they can get a leak on the other side of the artery and then start bleeding in the abdominal area. And so those people start feeling a lot of pressure in the back, lower back area, severe back pain, feeling like they have a bowel movement. And that's when we're scanning them and sending them to surgery. Other things that we want to do, we're going to teach them when they go home. So they're going to watch this site, and they're going to follow up with the cardiologist. They're also going to do the usual, decrease your stress, get some walking exercises, and low fat, low cholesterol. And then lastly, as far as the diagnostic testing, there's also an echocardiogram that's really important, because what does that do? Oh, I can't spell. That will check the pumping part of the heart. So when we think of heart failure, we can definitely, besides a chest x-ray and an EKG that could suspect it, an echocardiogram, because it can see what the chamber size is, the structure, the flow, the blood flow, and overall how it functions. And we can also do a stress echocardiogram where they're on the treadmill, and then we check their resting echocardiogram or ultrasound, as well as with exercise. Okay, and that is it for this hypertension and coronary artery disease wrap-up.